Hip and knee osteoarthritis part 2, physical activity, pacing and diet. So at the end of the last video, we spoke a little bit about how remaining active for somebody with osteoarthritis can make a significant difference. Here what we have in front of us is called the vicious cycle of reduced activity. This shows what can happen if somebody with osteoarthritis or joint pain becomes more inactive or reduces their activity. So here we can see reduced activity. This in turn will likely lead to weaker muscles. This will likely cause our joints to feel unstable. This will give us more pain when moving, and then this will generally increase the pain in our joints and cause us to become even less active again. So it's really important we don't get stuck in this cycle and remain active when we do have osteoarthritis. So here are the physical activity guidelines for adults and older adults. So firstly, if we look here in the top left-hand corner of the poster, it shows some benefits to being physically active, such as benefiting health, improving sleep, maintaining a healthy weight, managing stress, and improving quality of life. Now, if we look in the top right-hand corner of the poster, it shows certain medical conditions. Now, by being physically active, we can reduce our chances of getting these medical conditions. So, for example, by being physically active, we can reduce our chances of getting type 2 diabetes by up to 40%. So how active should we be? So here in the green, it recommends that we should be getting at least 150 minutes of moderate intensity activity per week, or at least 75 minutes of vigorous intensity activity per week, or a combination of both. So with our moderate intensity activities, such as swimming, a brisk walk, and a cycle, we should be able to maintain a conversation with somebody else while doing these, or be able to hum a song to ourselves while doing these. With our more vigorous intensity activities, such as running, sport, or stairs, we should not be able to maintain a conversation with somebody else, or we should not be able to hum a song to ourselves while we're doing these. This is how often we can tell the difference between what is a moderate intensity activity and a vigorous intensity activity. Here, it also recommends we build strength on at least 2 days per week, and it gives some examples of how we can do this. It also recommends in the blue here that for older adults, so adults over the age of 65, should do at least two days per week of balance activities. With these strength and balance activities, these could actually be done through the hip and knee exercises that we recommend for people with hip and knee osteoarthritis. You can speak to your physiotherapist about these exercises if you haven't already. So I think the take-home message from this slide is that any activity is good. The main thing is that you find an activity that you enjoy and that you can do safely. So we've talked a bit about the importance of being physically active, but what happens if we do too much activity too soon and without enough rest? Then we can get stuck in this cycle of overactivity. So someone with arthritis or joint pain, if they're overactive and do too much activity too soon and without enough rest, then they can get increased pain, stiffness, swelling. This can lead to prolonged rest and frustration. Then symptoms eventually do ease, but by the time they do, the person really wants to get back into their activity, and again they tend to get back into this cycle of overactivity. So we really want to avoid this cycle if at all possible. Pacing activities can help to avoid the vicious cycle of overactivity. So what type of pacing strategies do people with OA find useful? So resting between activities is definitely a really common one. So not doing all our activities at once, not doing them all in the morning, spreading them throughout the day, spreading them throughout the week, so we have enough rest between them. Another one is stopping a task prior to feeling pain or fatigue. So if you were driving a car, you wouldn't apply the brakes after you had hit something or hit a wall. You would apply the brakes beforehand. So this is important with someone with osteoarthritis. You want to stop prior to feeling a significant amount of increased pain or fatigue. This can be done by sticking to time limits. So set a timer, and then you can gradually increase the time of these tasks or this activity and gradually build. So why is pacing activities useful? So ultimately, people who pace their activities will generally experience less flare-ups. This will put them in control of their arthritis, their activity, and ultimately give them more control over their life. So next we're going to discuss diet. So the main link between diet and joint pain is its effect on how much you weigh. The heavier you are, the greater the strain on your joints. Weight can be maintained by a healthy diet and exercise. We've already discussed exercise, and now we'll discuss a healthy diet. So within a healthy diet, you should be aiming to eat at least 5 portions of fruit and veg every day. This will reduce your chances of stroke, heart disease, and certain cancers. Next, we'll have a look at carbohydrates. These provide a good energy source. Base meals on potatoes, bread, rice, pasta, or other starchy carbohydrates. As these make up a big portion of your diet, it's important that your portion sizes are not too big. Try to stick to higher fibre whole grain varieties such as whole wheat pasta or brown rice. It's also important to have some dairy or dairy alternatives in your diet. These provide important vitamins and help to keep your bones strong. It's also recommended to eat some beans, pulses, fish, eggs, meat, and other protein. These foods also provide minerals and vitamins. You should aim to eat 2 portions of fish each week, one of which should be oily, such as salmon or mackerel, and you should try and eat less red processed meat, such as bacon, ham, and sausages. So what are the top tips for maintaining a healthy diet and weight? So first thing is portion size. So we often see people do eat the right things, but they just eat too much of them. So don't feel like you have to fill the plate. Second thing, it's important to be realistic. Third thing, reward yourself. So, give yourself a treat every now and then. And all these things will allow you to be consistent. And that's probably the most important thing with any diet.